With our coverage on the health sector, we now want to cross over live to Nyeri, one of the lead counties where the Universal Healthcare Project is on pilot. And let's just link up with our reporter Ibrahim Karanja just to give us a feel of the state of affairs on the ground, especially in public facilities, healthcare facilities, which have been affected by the nurses' strike, which has entered day 2 in some of the institutions of healthcare. Now, Ibrahim Karanja, good afternoon. What can you tell us about the state of affairs in Nyeri County?
Well, good afternoon, Jesse. The situation in Nyeri County is that the nurses' strike has taken effect. And Jesse, it is having a toll. It is taking its toll actually on the biggest health facility in the county. That is the Nyeri County Referral Hospital. And this is where I am standing, Jesse, right now. It is visiting hours in this particular facility, and just friends and family to patients who have been admitted in this facility are actually visiting them. But what we were able to witness early in the morning and throughout the day is that there is a big reduction, or a huge reduction in the number of nurses providing services in this facility. In the morning when we arrived here, we found nurses actually, but they were outside the facility just converging and to discuss their issues. And the moment they saw that members from the press had arrived, they walked out from this facility, only leaving the nurses who are in charge of wards. So only a countable number of nurses are currently in this facility taking care of the patients. Most of the others have actually downed their tools and they left this facility very early in the morning. We have seen a scenario where one particular ward with a big number of patients is being attended to by only about one nurse who's in charge, and also interns, trainee nurses who happen to be at this facility at the moment. But we were able to speak to some of the patients while we were making that spot check inside the wards, and they said that the few available nurses, the one in charge or plus the interns, have been able to actually take care of their needs. Those who needed dressing, those who needed other services have been able to be served by the few available nurses. Jesse, we were also able to move around to other health facilities in the county, and especially in Nyeri town. We went to Nyeri Health Center and also the Mount Kenya Health Center, which are all government facilities. And especially at the Mount Kenya Health Center, services are still ongoing. Nurses are still present, but there is facility that has actually been majorly struck by this particular strike of nurses is the Nyeri County Referral Hospital. Early in the morning, we saw patients at the outpatient department are flocking, of course, owing to the fact that not so many nurses are involved at the outpatient department. The services of the nurses coming in immediately after one has gone through the outpatient stage. In case one is admitted or in case one needs specialized care, that's when probably the nurses come in and try to help. So the the people at the outpatient department are still as many as they usually are every day, and they are being taken care of, but the patients inside are the ones who've been affected because there is a very small number of nurses available. Yesterday, Jesse, there was that press conference by the Kenya National Union of Nurses in Nyeri County with their secretary, Beatrice Ndwati, actually stating that they are going to down their tools as from midnight of last night. That is when this strike in Nyeri County took effect, and they cited, among other things, lack of actually the county owing them arrears in terms of payments. And they also said that the county was supposed to have added the amount each nurse is getting in terms of uniform. She said that at the moment, Jesse, a particular nurse or one individual nurse gets about 10,000 shillings for uniform, while they had an agreement of about 15,000. So the county is yet to honor that particular agreement. Also about their payments, saying that the county has actually held on to their money for some time now, and also saying that the county has been involved in a cat and mouse game with them, giving them promises that they do not fulfill. Now that brings us, Jesse, to the topic of the county government having issued a letter to the Kenya National Union of Nurses, the Nyeri branch here. We were able to see a letter from the ministry or the cabinet or the County Executive Committee member for Finance and Treasury, that is Thuo, who said that, or in the letters assured the nurses that their money has been allocated. It is in the budget, and they are going to get that their money by the end of February. That is a letter we were able to see from the County Executive Committee member for Finance and Treasury in Nyeri County. But what we do not know, Jesse, so far is whether the nurses union in the county have received that letter, because like they said yesterday, they have been involved in so many talks with the county government in terms of these are the benefits we want, these are the things we want to be looked into. But they say that the county government is yet to honor any of the promises or any of the agreements that they have been having. We expect the Kenya National Union of Nurses Nyeri branch to be having a press conference in some few minutes, and we shall be asking them, first of all, whether they are in receipt of that particular letter from the county government, and if yes, whether they are going to call off the strike in the county and get back to work, owing to the fact that that letter now tells them that their money has been accounted for and they will get it by the end of the month, or they are still going to ensure that they are on strike, owing to the other fact that they say they believe, or they have been saying, that the county government has been taking them around in circles. So that is the situation in Nyeri County, with patients at the Nyeri County Referral Hospital being the people who have been majorly struck by this nurses strike that is ongoing and started in Nyeri.
All right, many thanks, Ibrahim Karanja, bringing us up to speed with the state of healthcare in public facilities.